Hey, I'm Dr. Montague here at the Quatela Center for Hair Restoration. Here with our beautiful model, Matt here. Matt's one of our hair technicians. We wanted to talk about frontal hairlines, how we design them. In some ways, he's a great model. In other ways, he's terrible in the sense he's got great hair, but he does have some temporal recession. And so theoretically, if Matt so chose, he could do a hair transplant to kind of fill in these temporal areas. The first thing I notice is that Matt's very frontal peak of his hairline is in perfect shape. If we were to measure this out, he's 5.5, 6 centimeters, which in a male is like really, really good. You want the break point between the temporal hair and the frontal hair. You want that kind of convergence point to be in line with the lateral canthus. So I'm always looking at patients from here, kind of drawing an imaginary line up like that. If we wanted to bring this forward, we just kind of have to keep that imaginary line in our minds. In Matt's case, I would want to do just a little bit of temporal thickening here to bring this up. We always want to dive, backward from this point on the temple and backward from this point on the hairline to make sure we're always having some degree of temporal recession. I'm using this again as my natural convergence point, and I'm bringing this over from the point that we already defined at his very frontal peak and coming to make that our convergence. You want it to actually be a little bit thin right in the front because that's what gives it a natural sort of progression. So that gives you an idea of what we go through when we're designing hairlines.